Thank you so much for joining us today in this episode of Focusing on You. I'm so excited to share with you that we are here live at the 10th annual East Coast Shag Classic here with Hope Abounds. So we're going to talk a little bit today about something that everybody truly needs to know about, which is just understanding your family history and your cancer genetics. So we'll go ahead and get started. So once again, I'm Heather Jeter. I'm the Educational Director with Hope Abounds. I've served in this capacity, thankfully, for quite a long time. I'm excited to be able to share with patients and physicians how they can truly understand the cancer genetics world better and empower themselves ultimately to get the best care possible. So, 1 out of 8. Doesn't sound like a big number, but what if you're that one, the one patient out of 8 that is diagnosed with cancer and has a gene mutation? The only way that you know is if you're tested. That's it. That's the only way that you know. And we'll talk a little bit about this as we get into it. But out of those 1 out of 8, this right here, 1/3 of patients that do carry a mutation, it changes the way that they're treated from a therapeutic option. So a medicine that's given, there are actual medicines that are tied into these gene mutations. So it changes outcomes for patients. So hopefully these patients, if they know their genetic mutation, these doctors can tailor, we talk about personalized medicine and tailoring things to that specific patient. Your genes can tell doctors the specifics on the medication that's needed to minimize side effects and hopefully have better outcomes. So keep some of these numbers in the back of your mind because it's really important and it really truly matters to empower you to know more for you and your loved ones. So not many of us are flying these days, but if you were told that you were going to have an 87% chance that if you got on a plane, that you wouldn't make it to your destination, would you get on the plane? No. Most people wouldn't. What about a 50% chance? No. So everybody makes choices, and those numbers I want you to keep in the back of your mind, 87 and 50, because those are the risks associated with cancer if you carry certain mutations. So everybody knows who this woman is, right? Angelina Jolie. So she was in the news a while ago where she decided to proactively have both of her breasts removed. She had a prophylactic mastectomy. She also decided to have a prophylactic oophorectomy. So she had her ovaries removed as well. Does anyone know why? She did. So her mother had breast cancer. She beat it, and she passed away from ovarian cancer. Her aunt died from breast cancer 3 months before Angelina Jolie's surgery. Her grandmother had died of ovarian cancer. So you see these people in your family not being able to make those decisions themselves, right? They get in a situation where once you get that cancer diagnosis, you're on the timeline of your physicians and their treatment team. You have to take that path that they say, this is where you go, this is the treatment you get, these are, boom, boom, boom. She decided to take it into her own hands. She's raising a brood, and she said, I'm going to proactively not have the same outcomes that my mom, my aunt, and my grandmother had. I'm going to proactively have surgery done to change those outcomes. So she had that 87% risk that we talked about of breast cancer and a 50% risk of ovarian cancer. So back to that plane analogy, if she knew she had an 87% risk of developing breast cancer, she decided she was going to have surgery. Same thing with ovarian cancer. And everyone has a different choice to make, but at least if you know the facts to be able to make that choice. Just like if I told you you had an 87% or a 50% chance of not making it to your destination if you got on a plane, you at least have the facts, right? And you can choose whether or not to step onto that plane. So this is my family history. And it's a little hard to see. The squares are the men, the circles are the females. If you see a slash through it, that means those people are deceased, some of them from natural causes. If you see any color in any quadrant, it's because someone had cancer. Now, not every time someone gets cancer, there's a genetic component associated with it, right? There's a lot we don't necessarily know. We're finding new things out every single day. What I can tell you is that on my mom's side of the family, you can see over that way that my aunt had breast cancer in her 40s. She's still alive today. My uncle had prostate cancer in his 60s, which I'll tell you is part of the same syndrome. If you go up, my maternal grandmother had breast cancer in her 50s and 70s, and then my maternal great-grandmother had breast cancer as well. On my dad's side of the family, my paternal grandmother and great-grandmother both died of ovarian cancer. And when you see that sort of a cancer family history, it's just a situation where you need to step back and look at things. So every single cancer type, except for lung, is within some sort of a syndrome. And we'll go over it. Some are more connected than others, but I've been tested for everything that I could get tested for, everything that science knows about today. And there is no known mutation. But in my mind, it was important for me because I want to stop it here. I don't want more colored circles or colored squares, right? So knowing this information and empowering myself to get tested will hopefully help me prevent future generations from developing cancer like my family members. Now, I could have been the lucky flip of the coin too. So most of these mutations are autosomal dominant, which means that if I carry a mutation, my kids only have a 50% chance of inheriting it. So am I just the lucky one? Did I just not inherit it? Or is it a situation that there really isn't a genetic component in my family? The only way to know that is to test some of these other people. Some of them have passed, so they can't be tested. So testing keeps on changing, and who should get tested keeps changing. What I want you to think about when you're thinking about your own family history are these three things: young, multiple, and rare. So all of you will be very happy to know that our guidelines, so National Comprehensive Cancer Network, which is what oncologists live and die by, thinks young is 60. Who's excited that 60 is young? So 60 is young. So certain tumor types and certain pathology that your breast cancer tumor or prostate or colon cancer has, if it's 60 and under, that's considered young. Multiple is if one person has multiple cancers. And then there's rare cancers. So rare is an ovarian or a pancreatic cancer. So I'm going to go through the two different syndromes that are most common and give you some information on how to empower yourself to just ask the right questions and know what to say when you talk to your doctor. So can you guys see this okay? I know there's a little bit of a glare. Okay, so this is looking at the breast cancer risk. So within hereditary breast and ovarian cancer, the spectrum, it is breast, ovarian, pancreatic, and prostate. So those four kind of go together. So when you're thinking about your own family history, if there are any of those in your family in clusters, then it's important to know. And that adds to the reason why you should be tested and understand and know. So in the top left-hand corner, it says more than one relative with the same type of cancer. Think back to my family tree. How many people had breast? Those are clusters, right? A family member with multiple cancers. So that would be someone like Angelina Jolie's mother that had breast and ovarian cancer, multiple cancers, different types. the top right talks about a family member with a cancer that's atypical for their sex, like a male breast cancer. It doesn't happen often, but when it does, there's a very high correlation that that patient probably has a BRCA mutation in their family. And then in the bottom right, you can see cancer in both of one organ. So that would be as in two primaries, so two different breast cancers. It could even be in the same breast, but they're two different cancers within the breast. So these are some of the things that should raise a red flag for physicians. And it's not just about, as I said, in this spectrum, it's breast, ovarian, pancreatic, and prostate. Those are the four. From an insurance perspective and a guidelines perspective, think about the young, so 60 and under, the rare, that ovarian and pancreatic are considered rare. And from a prostate, they say an aggressive prostate, so a Gleason score of greater than or equal to 8. So when a biopsy is done for a man on their prostate, they're given a Gleason score, and it is from 0 to 10. 10 is the most aggressive. So on the latter end, that's considered a person that needs to be tested, because that man, just like a female, can also pass that gene on to their children as well. So it's important for them to know. The second syndrome I want to talk about a little bit is Lynch syndrome. There are 10 cancers within this spectrum. And anytime I'm talking to doctors, I always say this is like the smart doctor syndrome. Like if they catch this, it's like kudos to you, because it's tough to find. So it is just as prevalent as a hereditary breast and ovarian cancer diagnosis, but there's no Angelina Jolie. So we don't have anybody that has had Lynch that's come forward in the public eye that shouts from the rooftops, I have Lynch syndrome, and understand my story. But the cancers within that spectrum are colon, gastric, pancreatic, it says urinary tract, kidneys, prostate. And then also from a female perspective, endometrial cancer is there. Some of the others are hepatobiliary tract, small bowel. It says brain cancer, but it's specifically a glioblastoma, which is a certain type of brain cancer, and then also some skin cancers. So as I said, it's a little bit more undefined and harder from a physician's perspective to be able to really know this syndrome as well, but it's just as prevalent as hereditary breast and ovarian cancer. So as I said, there's so many clusters of different cancers within these different spectrums. What's important to know is just understanding your family history. So I encourage people, when you're together, there are some families that want to talk about everything, right? And everybody knows everything that's going on. And then there are some families that are super private and they don't want to talk about it. They don't want to discuss anything that could be considered dirty laundry. Some people are okay with talking about their cancer and they want somebody to go through that journey with them. Others aren't. I encourage you to ask questions. You know, it doesn't matter what age you are. You can say, well, I remember Aunt so-and-so passed away when I was young. Do you know why? And it might have been a heart attack. It might have been something minor, but maybe it was ovarian cancer. Maybe it was, you know, some sort of a female cancer. And that would be something that you need to think about. So when you get together with your family, or you're doing your Zoom calls these days, or however you're connecting, ask questions and know your family history. Because the more people in your family that do have cancer, the more important it is for you to empower yourself to get tested. So here at Hope Abounds, you guys should know by now, we are all about self-advocacy. You need to speak up. You need to advocate for yourself, for your loved ones, because the reality of it is, as much as I hate to say this, we are a number. We go in and see our doctor, our family practice doctor, even our oncologist, and we are one of how many that they see that day, right? So we need to take our health into our own hands. Same thing when you're advocating for your friends and family. Know your family history, ask questions, but go in there and know what you want. So you know your body best. We're going to be talking to two women that both of them had gone in to their doctor and it was like, oh, it's no big deal. It's no big deal. they had breast cancer. You know your body. You know the changes of your body. You need to be an advocate for yourself. Keep pushing until you get somebody to listen to you. You need to be heard. If you feel like your physician is not listening to you, find another doctor. Sometimes it's good to make a switch, get a second opinion, because no one else knows your body and knows what you need better than you do. So you have to take that, and own it. And this is just a great little slide because, you need to be able to articulate what you need, but sometimes you just need people to listen and come in with an open mind. So even if they don't think you need genetic testing, if you truly feel like you do need it or anything done, you need to keep going until you find a physician that's actually willing to listen. So how exactly do you get tested? So there are two ways. We all have genes that make up our body, right? And so you can either get a blood draw done, which I'm not a big fan of people poking needles in me. So there's also the saliva sample. So they're both just as they're equivalent. So whether you give a saliva sample or a blood sample, it's DNA. DNA is DNA. So you can get it done in any doctor's office. They should be able to do it. And the interesting thing is that some are more willing to do it than others. And more importantly, not all labs are created equally. So you're making a big decision based on these test results. What if you got a test result back that said that nothing was there and there actually was something there, right? You wouldn't be managed appropriately, or vice versa. You don't want something that's a false positive and to do something that is proactive that actually didn't need to be done. So there are very reputable labs that do this, and there are multiple labs. And I'll talk a little bit about them, and I'm happy to talk to anybody one-off afterwards as well about that. So here's a big question. How much does it cost? Does insurance cover it? So insurance does cover genetic testing. If you meet the criteria, it's usually covered in full. If you don't meet the criteria, there are amazing labs right now that charge $250 for this test. And it's a very large panel, and you can get everything done. When I worked for some of these other genetic testing labs in the past, we would say 9 out of 10 people pay absolutely nothing. And that's the truth. 9 out of 10 pay nothing. The average out-of-pocket cost was less than $100. But if you choose not to run it through insurance, if you don't quite meet criteria, but you're like, I still want to know, you can pay $250, a payment plan, everything else with a reputable lab and get this information. So 10 years ago, when I first started working in this industry, it was $4,000 to $6,000 for the same exact test result. So it's definitely changed. It's more affordable, and it's made so that cost should not be a barrier to people getting tested. I also wanted to talk about GINA, or the Genetic Information Non-Discrimination Act. People always ask, can I be discriminated against if I know that I have a genetic mutation? And the answer is that you can't be discriminated against due to GINA. This law went into effect in 2008 for employment or health insurance. So they cannot discriminate. If you're concerned about carrying a genetic mutation, you don't yet have cancer, you're more than welcome to go get life insurance. Now, I can tell you personally, when I went to get life insurance, I had no cancer, but you saw my family history, right? My life insurance is actually pretty expensive because of all the cancer in my family, even though I don't carry a mutation. Conversely, I have a friend that does carry a mutation. She went ahead and had a prophylactic mastectomy, and her life insurance rates actually went down because she doesn't have the organs anymore that harbor the mutation risk, right? So people always ask about the life insurance thing. If it really is a concern for you, go get tested or get life insurance prior to getting tested. If you already have cancer, that's off the table. You're going to be at the same risk whether you have a mutation or you have cancer. So life insurance, they can still do what they want. As far as, health insurance, you can't be discriminated against. So what is your why? But more importantly, who is your why? It's important to know because it doesn't just affect you. It can affect your medical management, exactly how you're going to be treated, but it affects your kids, your siblings, your parents, your cousins, your, generations to come. There's a possibility to be able to stop it and to change things. And that's why genetics is amazing, because we can do something about it. There's so many things that we can't do anything about, but I empower you to just ask the questions and know a little bit more and take some ownership of your health. So this is my why. That's my clan. So that's Ella, that's my husband, and I'm there in the middle, Allie, Kate, and then Lincoln. And if anybody that's from here locally, you can know this is the little zoo here in town. So right before we take questions, we want to thank our sponsor and go to a commercial break.
For 35 years, Logan Homes' mission has been to build homes and develop communities where value, location, and lifestyle come together. With a state-of-the-art design studio, you can personalize your home to fit your lifestyle. Explore a wide variety of floor plans ranging in size, style, and price. Whether you're building or buying a move-in ready home, Logan Homes can help you find the ideal community and home to fit your lifestyle. Get started today and explore the Logan difference at loganhomes.com.
So welcome back. Thank you again for joining us. So we are here live today at the Holiday Inn Sun Spree for the East Coast Shag Classic, and we're just taking some questions after we discussed a little bit about cancer genetics. So what questions do any of you have for me? Yes, the question is there's not a lot of cancer in the family, but at this point, should testing still be done? And how's it going to change things? So it's a great question. So it might not change anything for you today, but what if you found out that you had a mutation that you could potentially have passed on to your children? And you say that, I'll give you a perfect example. One of my friends has a BRCA mutation. She inherited it from her father. There were 5 girls. All 5 girls inherited the mutation from their father. He never got cancer, but 3 out of 5 of the girls all had breast cancer. 2 out of 5, they had a prophylactic mastectomy and oophorectomy done. So sometimes it's not about how it's going to change your health care, but it's about how you would change things for your children. And none of this is meant to be scary. And so I know sometimes it seems overwhelming, but we go back to the whole knowledge is power. And it's so important just to be empowered to understand. And I said in the very beginning, if you get diagnosed with cancer, that's scary, right? The big C. It's how are you going to go down that path? And you start thinking all of these things, is my hair going to fall out? What's my treatment going to look like? Am I going to be able to work? Are we going to be able to? There's so many things. If you found out that you carried a mutation, you get to make that timeline. So even if it's not for you, if it's for somebody that you love, it takes the C out of it, and they get to empower themselves to be able to be proactive about it. And not everybody chooses to take proactive measures, but what can happen if you decide not to do, an actual surgical, being proactive, you can do increased screenings. For certain mutations, colonoscopies are recommended every year instead of every 5 years. Same thing with breast cancer. It goes back and forth. So guidelines recommend if you know you carry a mutation that increases your risk of breast cancer to have an MRI with contrast and then a mammogram every 6 months. So you don't have to go to the, surgical end. You have choices in between, but it changes things, not just for you, but it can change things for your family. Did that answer your question?
Yes, it does.
Okay. You're welcome. Yes. So the question was, is the PSA test for prostate cancer for male patients reliable? Not really. I mean, it's better than some other things that they have, and it gives direction, right? But there are lots of things that can increase that PSA that have nothing to do with cancer. So it's a screening tool that provides direction, and it's better than anything else that's out there right now. But there are definite fluctuations. So here's a perfect example. Men that ride a bike. I have a Peloton, love it, but men that ride a bike, their PSAs are higher. So it has nothing to do with prostate cancer. It does increase their PSA. So the jury's out, but it's kind of like ovarian cancer. There's no great screening for that either. They can do a blood test called a CA-125, but there are a lot of false negatives, there are a lot of false positives. There's no great screening. So do I encourage you to continue to go to the urologists and, get PSA screenings? Absolutely, because that's what we have. That's the best tool that we have to give some sort of a direction to predict. Is it a black and white, cut and dry? It's not. Yep. Yes. Yep, so the question was about pap smears for women and the changes in frequency. That is a very controversial topic, even in general, across the board, not just for us like over 65, but they're also saying that the frequency should be spaced out substantially longer than it used to be. So what they found is that they were over-diagnosing things that most of the time, if there's something growing within your uterus or cervix, it is a situation that it's slower growing. And so they feel like at a longer frequency, they can still get the information that they need. Do I think it's right? Not necessarily, but insurance is changing the way that they're paying for these. They go with what the guidelines say, and the guidelines have changed, and so insurance isn't paying for it if it's being done more frequently.
Well, the only thing is, at the age of 65, they said you never have to have one of these again. What is that because of the insurance isn't paying?
Yeah, so the follow-up to that is, she said, after 65, is it that insurance won't pay? I'm not going to say that they won't pay, but the guidelines say that your risk of some of those cancers go down. So I don't know that I absolutely agree with that because, you can be diagnosed with endometrial or even cervical cancer at, a later age. But the guidelines have just said that the increased screening and increased cost to the healthcare system doesn't warrant what they're getting out of it. You're welcome. So 10 years ago, when I first started in this industry, there were, less than 10 that they knew were clinically actionable, that they were actively screening, that made a difference. Now, they look at the whole exome, which is over 22,000 genes. So a lot of these panels look at, 200 to 300 that they know are specifically clinically actionable. But the organization I work with now, they look at the whole exome, which is over 22,000 genes, the whole transcriptome, which is all of RNA, so DNA, RNA, and immunohistochemistry, so protein screening to be able to give therapeutic associations for a patient's specific tumor. So when your biopsy is done, it's sent to a lab, and really smart people cut it out under a microscope, analyze it, and are able to give a specific therapeutic association and clinical trial opportunities based on how your tumor it actually looks. It's crazy. Crazy, yes. Elizabeth asked about if you test negative, is it going to change maybe some of the other screening and prevention that can be done down the line? So from a hereditary cancer genetics component, if you're born with a mutation, it's in every single cell of your body. So they call it one hit. It takes 2 hits for cancer to actually develop. So if you don't have that hit, if they don't find the hit, from that perspective, it's not going to change how you're being managed. But if you have a lot of cancer in your family, which you, I know, sir, said you didn't, if you have a lot of cancer in your family, then in being able to verbalize that to your physician might change your screening frequency. You're not going to develop a germline genetic condition, at a certain age. Cancer, like I said, is a 2-hit hypothesis. So you carry one of these genes, you have one hit. We're all breathing the same air, eating the same food, exposed to the same who knows what, and in the air we breathe. And that second hit happens, and so that's why a lot of the cancer is earlier. It doesn't mean that, people get 2 hits, right? And you get cancer without carrying a mutation because we're still eating the same food and breathing the same air. It usually just happens at a later age. So there's a difference between a germline mutation that you're born with and a somatic mutation, which is how it's developed. So that's the 1-hit versus 2-hit. So you can have a somatic mutation, a tumor just develops within your body, right? You have 2 hits, just develops, starts mutating, something's wrong, versus a germline mutation that you're born with it. So there are 2 different types of mutations. So this testing looks at germline mutations to know if it's in every cell of your body. Hereditary cancer genetic testing looks to see if every cell in your body carries that specific mutation, whatever you're looking at. Yep. So, oftentimes when, just to reinforce so everybody, that isn't here live with us can hear, when you go into the doctor, oftentimes you're asked, well, what's changed? And it's just sort of a fleeting question that, you're asked. And sometimes you don't necessarily think of people that have been newly diagnosed, right? Since the last time you've seen the doctor. Even if you're doing a virtual visit, they're going to ask the same question. Well, what's changed in your health since the last time I saw you? So it's important to let them know if anybody has been newly diagnosed, if you found anything else that you'd never shared with them before, it's important to share that information because the more that you can build the story, the better it is. Especially when you're going into a doctor and you're quote unquote healthy, right? You're healthy. And so you're trying to find out if this is something that might affect you or your family members down the line. Especially in a primary care setting, they have a million things to do within the 7 minutes on average that they see you. So if you feel like this is important, you need to make sure that you put it on the radar and you push a little bit for a little bit of extra time, even if you get 8 minutes or 9 minutes, because it's important for them to know what's new, what has changed, what do you know now that you didn't know before. Did that answer it?
Yes.
Okay. So 3 generations are important. So even my great-grandma is important to know. Second cousins is important to know. And so it's a lot of families will say, well, we're a small family. It's important to know, multiple generations out. So all of the guidelines say 3 generations matter. So it's important to know what my parents, my grandparents, and my great-grandparents had. Any other questions? These are great questions. No? Well, thank you all for joining live. I really appreciate you taking the time to sit here and listen and ask great questions. Please go to the Hope Abounds website. We also have a Roku app just to be able to learn a little bit more. There are quite a few different topics available that are focused on patients and understanding how to navigate as a patient or a caregiver the cancer journey. So thank you and have a great time at the rest of your East Coast Shag Classic.